Hello, my name is Meghan Hazer. My position is City Planner 1. I work for City of Baltimore Department of Public Works in the Watershed Planning and Partnerships section. We are responsible for the watershed planning initiatives under the MS4 permit. But I saw a real opportunity in terms of planning MS4 projects to really look at the way people interact with the environment. The project involved creating a system of prioritization maps that expanded above and beyond what's typically required for the watershed assessment. So the product was watershed assessments, and this was a series of prioritization maps. So we chose to prioritize based on three main things. The first was factors affecting socioeconomic and racial equity. So we specifically considered race because that has driven decisions in the past that have led us to this point, and income and also life expectancy. And then on top of that, the things you typically consider in a watershed assessment: slopes, soils, pollutant sources, things like that. And then we looked at specifically those built environment health factors that through the MS4 projects, we have the opportunity to influence. So the outcome was a three-tiered map that prioritized locations based on the socioeconomic and racial equity, health supportive communities factors, and the physical features that would be advantageous for the cost-effective implementation of environmental site design features. And then layered those together to create an overall prioritization map. So what that yielded was areas that considered all of those factors together, where as an MS4 jurisdiction, we can ask first. So from an equity perspective and from a health perspective, the last thing you want to do is have somebody feel like you're making decisions for them, that you're taking that power of self-advocacy away from them. So these are priority areas where we will ask first, not where we will do anything specific predetermined at the outcome. So if this could act as an example of something new, of one of many early precedents for specifically integrating public health and equity in what is traditionally like an environmental process, that would be amazing. The only reason we're even having this conversation is because those who are leading above me were willing to try something new and allow it to be a first step in advancing that conversation. And now we're in a position to do that. We're in a position to use this as a way to prioritize, adaptively manage, continue to learn and grow towards a shared goal. If the leadership team that's above me wasn't willing to do that, none of this would be possible.